These events are not isolated. They are warning signs. Climate change is what experts call a threat multiplier. It worsens food insecurity, deepens poverty, and forces people to flee their homes. Vulnerable groups like elderly, children, women, and low-income families are the most at risk.
Change. It is the inevitable. That is what we have suffering from in those recent years and up until now. Climate change. The weather is unpredictable and harsh. So much so that the effects of it manifest and affect certain aspects of our living.
From illnesses like heat strokes to barricades to irritating emotions, these are all a common ground for the effects of climate change. Change is everywhere. But come to think of it, why are still people not apprehended by this? Why are people not moving? Do they really need to see the end of the world in order for them to change?
And this documentary will focus on how climate has hit our behavior, public safety, and public health.
Many of us are feeling aggregated as time goes on. Many just think that it's just a common occurrence at this point. But have we realized that maybe the contributing factor here is the temperatures? And what does that correlate with? Climate change. It is very concerning to see that even though many are informed about the dangerous effects of climate change, the change is nowhere to be found. And yet people still question, why are there many typhoons crossing around our country when yet we are the main contributing factors to these changes?
These typhoons brought about immense pain, torture, dangerous conditions towards our public health, safety, and our human behavior. People need to open their eyes and minds about what is really happening with this world, on how torturous climate change can be to the lifestyle of humanity.
The severity of this health risk will depend on the ability of public health and safety systems to address or prepare for these changing threats, as well as factors such as an individual's behavior, age, gender, and economic status. Impacts will vary based on where a person lives, how sensitive they are to health threats, how much they are exposed to climate change impacts, and how well they and their community are able to adapt to change.
Good afternoon po, Nurse Melissa Amor. We are from Southern Luzon State University main campus, and we are first year BS Accountancy. And in connection po to our subject STS, which is Science, Technology, and Society, we would like to conduct an interview about the effect of climate change to human behavior. For our first question po, does climate change truly affect human behavior?
Climate change affects human behavior. Yes, it affects behavior. At some point, like there is an increase with violent aggression with people or society, and there are also mental health challenges like anxiety, depression, and kaya kailangan talagang kailangan sa climate change ay nabibigyan ng o nakaka-apekto sa behavior natin.
How does climate change, especially extreme heat, affect human emotions and mental health?
Extreme heat sa human emotions nila tayo. Yung passion sa emotional or emotion ng isang tao, pag there is an increase or there is a extreme heat, merong changes of mood. Kaya yun sila tinatawag natin mood swings, tama? So pag may mood swings, so pwedeng may aggression ng isang tao or irritable do. Tapos, bukod doon, may discomfort, dehydration, may sleep disturbances ng isang tao. Kapag may increase ang irritability, it will cause to negativity ulit. Second, yung anxiety and stress. Yung heat, actually nakaka-trigger ng stressful ng nag-release sa katawan natin. Kaya nagkakaroon ng anxiety. Yun na. Sa ano naman, sa extreme heat, yung human mental health, yung heat, it can actually worsen the existing mental health condition of the patient or the individual itself, anxiety, depression, stress, yung post-traumatic stress depression. Or disorder. Yun naman ang aking opinion. Sinanggal ko.
Number 3, what mental health impacts are associated with climate change, particularly among youth and vulnerable communities?
Climate change has significant to mental health, especially dito sa mga young and vulnerable community of persons. These impacts include the youngsters. Sa youngsters na tayo, nag-i-increase increase of feeling of anxiety, may increase of feeling of depression, same thing yung tatlong yan, kasama pa rin ang post-traumatic stress disorder. Pag sa vulnerable community naman, iba tawag natin vulnerable community, these are the indigenous and indigenous people na may low income community, halos kulang na ang pambili ng nakakain. So, there's a big impact in psychological distress dahil limited lang yung adaptation capacity ng bawat bayo.
Thank you po. Can eco-anxiety lead to long-term psychological disorder?
For me, yes. Actually, an eco-anxiety is not a clinical diagnosis from our resident doctors. Ito kasi yung condition na pwedeng ma-trigger, na pwedeng mag-increase, na pwedeng mas lumalak sa isang tao o sa kanto na mayroon ng sakit ang condition. So, actually, napupulong siya yung intense ng anxiety din ang nag-develop ng kaya yun. Yung isang sa anxiety.
So, what psychological effects do climate-related disasters like typhoons or heat waves have on people long-term?
Psychological effect. Sa mental health impact, impact, it triggers or worsen the anxiety and depression. Those who are already vulnerable, post-traumatic as well disorder, exposure to traumatic events before, like flood, yung typhoon sa meron tayo before, that can lead to post-traumatic disorder. So, eco-anxiety naman, may kambang anxiety?
So, for last question po about sa human behavior, Nurse Mel, what advice would you give to young people struggling with fear or anxiety about the future of the world?
Okay. So, for us naman as sa medical field or nursing field, yung ginagawa natin dyan ay we actually practice self-care din sa ating pasyente or either any individuals needs help. We help them to build strong support with those individuals. So we're talking about the people who they trusted, so pinapaalala mo sa kanila yun. We also identify the triggers, kung ano yung nag-trigger sa mga talks nila para at least malaman natin kung ano yung maganda or ano yung pwedeng gawin natin para ano i-apply na pwedeng ma-relax yung pasyente. Like, for example, sa relaxation, may deep breathing tayo, na ginagawa meditation for patient para mas mabilis yung healing, pag-process natin.
And thank you po, Nurse Mel. So that's end po for human behavior.
Climate change is no longer a distant threat. It's now here, and it increases the danger we already face. From stronger typhoons to this record-breaking heat waves, our communities are now more exposed to danger, and it threatens lives, livelihood, and basic goods. Climate change is real. It's happening. But with proper planning, strong systems, and awareness, we can protect our communities and create a safer and more resilient future for all. So where does public safety come in? Public safety means protecting people from harm through safe infrastructure, effective emergency response, and crisis prevention. But this climate change is pushing the system to the edge.
Okay na po ba, sir? Start na po tayo ng ating interview.
For our first question po is, what do you see as the most pressing climate-related threats to public safety today? Or ano po yung mga nakikita niyong pinaka-nakakabahalang banta sa kaligtasan ng mga tao na naaapektuhan po ng ating klima sa kasalukuyan?
Yun, obvious naman. Sobrang init na ng panahon ngayon. Dahil sa climate change. Usually yung mga kantong sobrang init, nararamdaman lang natin yung summer. Pero dahil sa climate change, kahit hindi summer, possible na uminit ng ganito. At syempre, pag hindi summer, mas lalong uminit.
So, for our second question naman po is, paano po nakaka-apekto ang pagbabago ng klima sa kaligtasan at tibay ng mga mahalaga infrastruktura gaya ng kalsada, tulay at gusali?
Usually naman, kapag sa mga buildings or sa mga gusali, nagpa-factor na ng mga structural na yun nga, depende sa klima. Sa Pilipinas naman, meron ng tayong tag-ulan sa tag-init. So, yun nga lang, kapag tag-ulan, sobrang naulan naman. Tapos pag tag-init, sobrang naulit naman. And yun nga, dahil sa climate change, nagpapabago-bago siya. And so, yun, nakukonsider naman siya sa design. Kaya lang, yun nga, pagdating sa kalsada natin, dahil nasa climate change at sa sobrang pag-ulan, sa sobrang init, mas nababa yung integrity ng mga kalsada natin sa mga tulay. Kaya mas madaling masisira yung mga kalsada natin.
Based po sa experience nyo bilang electrical engineer, paano po nakaka-apekto yung climate change sa trabaho nyo po, sa mga ginagawa nyo?
Sabi naman, usually, siyempre, pag sobrang init, hindi kailangan mag-adjust ng mga dinadaanan ng mga wires. Then, kasi nakaka-apekto din yun sa kuryente pag sobrang init mo. Tapos, yun, siyempre, kinoconsider nyo sa design na ngayon kasi usually, dahil sa climate change, pabago-bago ng panahon. Yun nga, kaya sabi ko nyo, pagka-init, pag naulan, sobrang ulan, tapos mabilis bumaha, di ba? So yun, siyempre, kinoconsider nyo sa design na dapat yun nga, for example, yung mga poles natin sa mga electrical, dapat magiging palit sa init saka sa ulan. Kaya nang mapanatili yung talo ng oras sa mga bahay na aspect ng
So, number naman po is, ano po yung mga pangunahing hamon na kinakaharap ng mga ahensya sa pagtugon ng mga isyong may kaugnayan sa kaligtasan ng publiko dulot ng pagbabago ng klima, gaya ng kakulangan sa pondo, pagsasanay o teknolohiya?
Siguro sa mga ganun, sa mga agencies na nandito sa atin, siguro ang biggest challenge is yung implementation ng design. Kasi pagdating naman sa design, lahat naman yung nakakompute na. So yung pag-i-implement ka ng sa design, saka yung siyempre pag-turnover ng mga projects, usually dapat nag-solution sa design natin. So, depende na rin yung sa mga inspectors. So dapat pinag-tuloy ng maayos yung mga turnover sa amin ng mga trabaho ng mga contract. Sa ibang field ng engineering, yun nga tama sa design. Dapat maayos yung balik namin. Dapat tama yung mga ginagawa ng performance. Yun nga, para sa mga agency, kailangan ma-inspect nila ng maayos yun. So far sa design naman, hindi ka masyadong issue kasi yung mga nagde-design talaga is nag-aaral talaga mga nagkakadulong kasa ng design. So more on implementation yung challenges. Pag-upload ng mga ginawa nga ng mga
Sa next na question na po tayo. Actually, hindi po siya question eh. Pwede po ba kayong mag-share ng experience nyo na about po sa inyong trabaho na kumbaga po ay nakatulong kayo sa public safety ng mga tao, or kung ano po ba yung mga technicalities na kailangan para makatulong sa public safety ng mga tao?
Siguro, yun nga, sa public safety ng mga vehicle. Yun nga, sa implementation ng mga design na ginagawa natin kasi usually naman for safety, di ba? Kasi pagdating sa electrical, siyempre isang mali mo lang, sasabog na rin yun. O yun nga tinawag din, intentional man or unintentional. So dapat yun nga, sa amin sa trabaho, na mas inaayos namin kasi siyempre pagkatapos namin mag-turnover ng mga gawa namin, hindi namin alam kasi yung mga tao na pwedeng gumalaw sa mga nagamit. So yun nga, as a public safety, kinoconsider din namin mga installation, mga controls, for example, mga factor dapat matibay ka para hindi ka mag-cause ng accident.
So, that is all po for our questionnaire. So,
Thank you so much po
Thank
for
you po
your
for
time
your
and sharing
time.
your expertise.
Climate change has changed public health trends, with rising temperatures affecting everyone's lifestyle. Due to the different extreme weather events, health issues have been increasing, resulting in increased mortality rates. Rising temperatures cause heat-related illnesses and deaths, while intensified typhoons cause destruction and spread of infections. High heat index can lead to heat strokes and worse, death. It also accelerates the spread of infectious diseases as warmer climates allow disease-carrying insects, raising the risk of dengue, fever, and malaria. Climate change affects human health by speeding up the spread and severity of infectious disease. Additionally, it threatens food safety and nutrition by increasing temperatures that lead us to a rise in foodborne infections and decreasing crop nutritional value because of higher CO2 levels. Warmer waters promote toxic algal blooms, while flooding and excessive rainfall contaminate water sources, which further affects water safety.
Which demographic groups are most affected by climate-related health issues, and what preventive advice would you offer to them?
We actually have a lot of groups. For example, like women, children's, older people, ethnic people, mga communities. I think the most affected age, group of age is elderly. Kasi sila yung may higher risk for vascular disease or na heat stroke, ganun. And sila yung mas malaki ang percentage ng death or mortality. And, ano pa ba? Sila din yung most affected sa heat change or extreme heat na nararanasan natin dito sa vaccine.
What role can businesses play in educating the public about health risks linked to climate change po?
Yeah. So, role natin or namin sa community is actually to increase or leverage their trust. Okay? And then, kailangan natin silang paulit-ulit na bigyan ng paulit-ulit or i-remind or probably another new knowledge para may mga kaalaman sila and access to what? Access to community. So, to promote natin yung preventive measurements, i-advocate natin yung policy doon sa magiging changes pag nagkaroon ng climate change or magkakaroon din tayo ng what else? Yung bond doon sa family. So, nurse and community nurse together with the family. Yeah.
Let us draw inspiration from nature's resilience and humanity's ingenuity. With determination and collaboration, we can create a sustainable future that thrives in harmony with our planet. Thank you for joining us on this journey. Together, the future is in our hands.